Hello and welcome to the training session for dialysis facilities on reviewing the surveillance definition change for up-to-date COVID-19 vaccination status. My name is Jolie Siegel, and I work with the Division of Healthcare Quality Promotion at CDC. Next slide, please. Before we begin, as a general reminder, please contact the Centers for Medicare and Medicaid Services, or CMS, with questions about reporting requirements using the link provided on this slide. Next, please. The objective for today's webinar is to review the up-to-date definition change, as this new definition applies to reporting weeks beginning on September 26, 2022. We will then review example scenarios and discuss frequently asked questions. Please note that the slides from today's session will be posted to the NHSN COVID-19 vaccination website in the coming weeks. Next slide, please. Now let's begin reviewing the new up-to-date definition for COVID-19 vaccination. Next slide, please. The image on this slide shows the question on up-to-date COVID-19 vaccination status for the COVID-19 vaccination modules. Facilities should report the cumulative number of individuals who are up to date with COVID-19 vaccines for question 5. Next slide, please. Please note that this definition may change over time for NHSN surveillance to incorporate changes made to the clinical guidelines and recommendations. Therefore, facilities should refer to the definition on the first day of the reporting quarter. Facilities should use the definitions outlined in the document linked on this slide for each quarter. Facilities should review this document at least once per quarter to check for definition updates. Reporting periods for up-to-date COVID-19 vaccination data include quarters 2, 3, and 4 of 2022. Next slide, please. In May 2022, up-to-date COVID-19 vaccination was originally defined. In June, this definition was updated. This webinar will go over the newest update to the definition that will be used for quarter 4 reporting. Please note that facilities should use the definition for the quarter they are reporting for, regardless of when they report those data. For example, if this week I needed to go back and report data for a week in Q2 of 2022, I would use the up-to-date vaccination definition from quarter 2 of 2022. Today's training will focus on the latest changes made to the up-to-date definition, and this new definition will be used for reporting weeks beginning September 26. Before we review the specifics of the new up-to-date definition, let's review some key terms surrounding COVID-19 vaccination. First, we will define primary COVID-19 vaccine series. Completing a primary vaccine series means receiving a 2-dose series of a COVID-19 vaccine, Pfizer, Moderna, and Novavax, or a single dose of Janssen COVID-19 vaccine. We will now go over the difference between a booster dose and an additional dose. A booster dose is another dose of vaccine administered after receiving a primary vaccine series to enhance or restore protection, which might have subsided over time. An additional dose is another dose of vaccine administered to people who are less likely to mount a protective immune response after initial vaccination. People who are moderately or severely immunocompromised should receive an additional dose. We will now discuss the updated bivalent booster dose. An updated bivalent booster dose targets Omicron variants in addition to the original COVID-19 variants. Now we will go over an important point about data reporting. If an individual was administered 1 or 2 doses of COVID-19 vaccine after they completed their primary series with no further details provided, then for the purpose of NHSN surveillance, assume these doses are boosters and not additional doses unless you have specific documentation indicating that they received an additional dose due to having a moderately to severely immunocompromising condition. This slide shows the new definition of up-to-date COVID-19 vaccination that should be applied for weeks beginning Monday, September 26, 2022. The items in yellow are updates compared to the previous up-to-date definition. As you can see here, individuals are considered up-to-date if they have received an updated bivalent booster dose or received their last booster dose less than 2 months ago, or they have completed their primary series less than 2 months ago. Please note that this definition is the same for those who are moderately to severely immunocompromised. The following flowchart can be used to help you determine when individuals are up to date according to the new definition. Now let's review a few examples of how to report up-to-date COVID-19 vaccination status. This slide shows how up-to-date COVID-19 vaccination data are entered into NHSN. In this example, there are 40 patients. Of these 40 patients, 30 have completed their primary vaccination series. Among these 30 patients with completed primary series, 26 are reported to have received any additional or booster doses, and 26 are reported to be up to date with COVID-19 vaccination for question 5. Now we will go through some examples. Tom received 2 doses of the Pfizer vaccine and 1 dose of the Moderna vaccine as a booster. He also received an updated bivalent booster dose 2 months ago. Is Tom up to date? The answer is yes. Tom is up to date with COVID-19 vaccines because he received an updated bivalent booster dose. Here is another example. Sandy received 2 doses of the Pfizer vaccine and an original booster dose 4.5 months ago. Is Sandy up to date? The answer is no. Sandy is not up to date because she has not yet received an updated bivalent booster, and her most recent original booster was more than 2 months ago. The example on this slide pertains to the new Novavax COVID-19 vaccine. Frank received 2 doses of the Novavax vaccine. He received the second dose 1 month ago. Is Frank up to date? Frank would be considered up to date. This is because he completed his primary series less than 2 months ago and is therefore not yet eligible for an updated bivalent booster dose. Next slide, please. Let's now review some frequently asked questions, or FAQs. How do I categorize a patient who received a complete primary COVID-19 vaccine series of Moderna with the most recent dose received less than 2 months ago? This person would be included in question 2.2, any completed primary series, and question 5, up to date. Remember that this patient will no longer be considered up to date once it has been 2 or more months since their most recent primary series dose. They will not be up to date until they receive an updated bivalent booster. For question 2, a patient received a complete primary COVID-19 vaccine series 5 months ago, but did not receive any booster doses. This individual is not considered up to date because they completed their primary series over 2 months ago and have not received an updated bivalent booster dose despite being eligible for it. This individual would only be included in question 2.2, any completed primary series. This scenario asks about how to categorize someone who received a completed primary COVID-19 vaccine series of Moderna and 1 additional dose 1 month ago due to having a moderately to severely immunocompromising condition, but has had no booster doses. The individual is considered up to date because they received their additional dose 1 month ago, so they are not yet eligible for a booster dose. They would be counted in question 2.2, any completed primary series, question 4, any additional or booster doses, and question 5, up to date. In this case, an individual received a completed primary COVID-19 vaccine series and 1 additional dose due to having a moderately to severely immunocompromising condition, plus an updated bivalent booster dose. This person is considered up to date because they received an updated bivalent booster dose. They would be counted in question 2.2, any completed primary series, question 4, any additional or booster doses, and question 5, up to date. The last question asks, how do I categorize someone who received a completed primary COVID-19 vaccine series of Pfizer and 1 booster dose 2.5 months ago? This person would not be considered up to date because they received their last booster dose 2.5 months ago, so they are eligible for an updated bivalent booster dose. They would be counted in question 2.2, any completed primary series, and question 4, any additional or booster doses. We will now review how to access the additional resources that are available to dialysis facilities reporting COVID-19 vaccination data. The website listed on this page contains a variety of training materials, including data collection forms and instructions, quick reference guides, training slides, and information on CSV file upload. If you have any questions about NHSN, please send an email to usersupport@nhsn@cdc.gov. Please include weekly COVID-19 vaccination in the subject line of the email, along with your facility type. This concludes the presentation. Thank you so much for your time.